Greetings, everyone, and welcome to the International Association for Impact Assessment Virtual Symposium Opening Health Keynote. My name is Tanya Fraser, and I will be the moderator for today's presentation. On behalf of the team at IAIA, thank you so very much for your participation in this special event and on day 2 of the activities of the sessions. I would like to invite for Martin to please, or for Robert to please progress to the next slide. Yay. And then progress one more time to the next slide, if you would. Can you hit the next button? We're getting your camera. There we go. Martin or Robert, you can go ahead and stay on. That's totally fine. And hit the next button one more time for me. The joy of real life live technology. Next slide. There we go. So I have a couple of housekeeping things. Robert, stay on with me. Let's do this together. This presentation will be recorded. You'll be able to experience a presentation by Mr. Robert Boss, as well as a panel discussion today. And all of that will be recorded and available for you on the main virtual symposium site. If you have questions at any juncture during the presentation, you are welcome to add those to the question panel in your control panel on the right of your screen. Those can be questions regarding content, and those will be able to be brought up during, some of them at least, brought up during the panel. Any questions that aren't able to be attended to will be responded to on the bulletin board back on the main symposium website. Also, if you have practical or pragmatic questions, feel free to ask those in the questions panel as well. And a member of the IAIA staff will take care of those for you and make sure that you are settled and have all of your needs met. At the end of the presentation, you will also be able to receive a copy of the slides. These PowerPoint slides will be placed on the main symposium website right next to where the video is posted. Perfect. And next slide, please, sir. So I'm going to transition into an opportunity for Martin Burley to come on and introduce this man of the clicking hour and our first speaker, Robert Boss. So one moment as I invite Martin to the screen. There we go.
Hi, everybody. Just sorting out the technology here. Right, we're live. So it's my great pleasure to introduce our keynote speaker on health today, who is Robert Boss. And I want to start with a very brief bio from his very extensive bio. So Robert joined the World Health Organization in 1981, where he was assigned to the Secretariat of the Joint WHO, FAO, UNEP panel of experts on environmental management for vector control. And little historical note, Jean and I, who are both here today, started working with him on that at about that time. It was an interagency framework for the promotion of healthy design and operation of water resource developments. In the 90s, he moved to the WHO Environmental Health Program, and that led him and us to the development and promotion of health impact assessment. He provided support to member states for HIA policy formulation and human resources. In the 2000s, this led to comprehensive capacity development in the Mekong River Basin, as well as normative work on safe reuse of wastewater. From 2009 until retirement, he was coordinator of the WHO Water Sanitation and Health Program. And since then, he's worked as a consultant, including on a large HIA project in the greater Mekong sub-region for the Asian Development Bank. Over to you, Robert.
Good morning, evening, afternoon, everyone. And thank you very much, Martin, for that introduction. Thanks, everybody, for joining. And thanks to the organizers for inviting me to do this keynote. As all of you know, last week, the world reached a dramatic milestone in the global health crisis that we've been facing since the beginning of this year. The Johns Hopkins University reported that the number of 1 million reported deaths of COVID-19 had been reached in the 9 months that the virus has been circulating. And that means that this infection has overtaken other diseases like malaria, in its mortality. I'm trying to move to the next slide, but it doesn't seem to go. In its mortality on an annual basis, with the additional footnote that, of course, the inconsistent definitions of attributing the death to COVID-19. So as I said, the news from Johns Hopkins University about the 1 million reported deaths caused by COVID-19 indicated that the infection on an annual basis now has overtaken malaria, diarrheal diseases, tuberculosis, and HIV/AIDS in its mortality. Of course, noting also that the real number of dead may actually be much higher because of underreporting, and also because the definitions of attributing death to the COVID-19 virus disease has been, inconsistent. In any case, the pandemic has drawn our attention in a profound way to the level of unpreparedness to the emergence of new infectious diseases, which can plausibly be attributed to anthropogenic changes in environmental and social determinants of health. Because of this unpreparedness, immediate responses by national health authorities have focused predominantly on biomedical solutions, including the development of drugs and other clinical treatments that can deal with those patients who develop a serious, potentially deadly illness, and also, of course, the development and deployment of a vaccine that will provide protective immunity. And the question comes up whether a response to the environmental and social changes as the root cause of all this misery is still to come, or whether we will return to business as usual when the pandemic is under control. Meanwhile, of course, public health measures do not only aim at minimizing COVID-related death and disease, but they're also intended to safeguard the capacity of the health service to deal with the pandemic and also with the standard range of health conditions that are prevalent in local populations. And of course, this is an issue that also links to HIA, because we know that in HIA, the capacity of health services is an important criterion and indicator next to community vulnerability and environmental receptivity. So in the context of development projects, even with measures that address the environmental and social determinants of health optimally included in public health management plans, reorienting and strengthening of health services will always be a necessary component. Now, while waiting for drugs and vaccine, we deal on a daily basis with the public health measures we've all learned to live with: the social distancing, mouth caps, hand disinfection, isolation, and quarantine. And as the crisis drags on, governments will be faced with some stark choices. What are the trade-offs between reducing serious morbidity and mortality and protecting people's livelihoods? A question that is most acute in low and middle income countries that do not have the social safety nets that we have in high income countries. And this is a question that is also, of course, very familiar to HIA practitioners. How do we protect the most vulnerable, the elderly, people with chronic ailments or with dysfunctional immune systems, without affecting the young in their entitlements to education and development? An issue that also pervades public health in all its aspects, and that is at the core of HIA. How to weight this crisis, which focuses directly on the health of 7 billion plus human population on this globe, against other global planetary crises, which will perhaps less directly affect the well-being of the human population: global climate change, biodiversity loss, urban air pollution, unsustainable production and consumption patterns. Surely, those concerned with those various global environmental crises that we're facing will have looked with amazement and a certain envy to the powerful public health reaction that has been unleashed when it comes to protecting our own species, rather than the ecosystems on which we depend? And from a governance perspective, how do we overcome the obstacles and cracks that recently have become apparent in multilateralism with its opportunities for mutual reinforcement and collaboration between nations, giving way to nationalism, competition, and entering a race to the bottom? None of these questions, put in a different time frame, are unfamiliar to impact assessment practitioners. The issue of trade-offs, of priority setting, of decision-making criteria, and of cracks, redundancies, and tensions in governance structures are an inherent part of putting impact assessment into practice. So the next slide, please, Tanya. As I said, this keynote is about health impact assessment, and as the title indicates, it wants to explore the interface where policies and practice interface, and how actions on this interface can enhance the concept and implementation of HIA. How can we relate this to the reality we are now living in during this bizarre year of 2020 and to the scenarios that await us in the years to come? I think there's no point to oversell health impact assessment as a tool in the context of this crisis. The definition points to it, as you see on the screen. It's a development planning tool which is systematically applied to policies, plans, programs, and projects. So as an assessment and with its subsequent health protective and health promotional measures, it fits in established processes of policy formulation and policy adoption, and in the development project planning cycle. It is therefore not a tool that is really geared to handling natural disasters, humanitarian crises, civil unrest, or more specifically, global public health crises. For that, governments should develop emergency preparedness plans, and for public health crises, rely on the agreed international health regulations. At most, rapid HIAs can be applied to the options for responses to such crises. This definition that you see on the screen is the one developed by WHO and IAEA and published in 2006. It's based on an earlier definition by the WHO European Regional Office. And according to it, the assessment of health hazards, risks, and opportunities in the development context has a strong equity perspective. As you see, it's about the distribution of health effects within the population, and provides the evidence base on which health protective and health promotional measures can be designed. The objective of putting this combination of procedures, methods, and tools into practice requires a policy basis. In my presentation, I will look at a snapshot of the HI policy situation in a particular region of the world. But I also want to add that immediately that there are other policy dimensions of HIA. One which I will mention as well towards the end, which is the strategic HIA. Other policy dimensions, like the absence of explicit reference to impact assessment in the Global Sustainable Development Framework, the SDGs, and Agenda 2030, I will not go into, or the fact that in many countries the health component in impact assessment is dealt with often not very satisfactorily in the context of environmental impact assessment policies. So first, let's make sure that we also have a common understanding of what is policy. And Tanya, that's on the next slide. This definition talks about the intended course of principle of action to achieve agreed objectives, guided by clear decision-making criteria. This remains a rather fluid policy, as we see in the way it is dealt with in different countries. It depends on political and socioeconomic settings. Policies can be very ephemeral, depending on the whims of political leadership. They can be woolly to avoid issues of political conflict, politicized. Take it in the Spanish language, policies and politics are really one and the same word. Or they can take on an almost legalistic significance, such as in the strict policy frameworks of the European Union. Eventually, policies of proven value may indeed evolve into laws and regulations and provide frameworks that are more deeply rooted in justice systems and societal interests. Whatever the case may be, the value of policies becomes apparent only when we put them into practice. The policy framework for HIA should define the procedures, methods, and tools in a specific national setting. And the transition from policy to practice then becomes a bit of a murky interface because of this rather vague interpretation of what policies may be, where political will and expediency, resource availability, institutional capacity, intersectoral competition, and no doubt even personality clashes may play a role. The question is, what can we do to distinguish generic obstacles from obstacles that are HIA specific to help us smoothing the process of shaping practice based on policy? On the next slides, I will go into this area of the world that Martin already mentioned also in the introduction, and where we've been working as a team to look at HIA capacity building needs and opportunities. In 2016, the Asian Development Bank initiated a set of activities under a trust fund that had been established to address concerns over the potential spread of drug-resistant malaria. And one package in this set of activities focused on developing and strengthening capacity in health impact assessment, in part to target the procedures and operations of the bank itself, but also in part to target the 5 countries of the Greater Mekong subregion: Cambodia, Laos, People's Democratic Republic, Myanmar, Thailand, and Vietnam. This is a region where the countries together have over 240 million inhabitants, a region rich in natural and mineral resources. The Mekong River flows through it as a principal waterway, with several other large rivers running through it as well. And countries with a location in Asia between 2 big powers, India and China, which is very strategic. For most of them, annual GDP growth has hovered around 7% over the past decade, perhaps with the exception of Thailand, which went through rapid growth phase earlier, now has a more mature economy. And major developments are planned or underway in hydropower development, in the construction of major regional transport axes, in urbanization with major infrastructure, further intensification of agriculture and aquaculture and agroforestry, and the creation of special economic zones, which sometimes can be transboundary zones. Part of this HIA assignment included a country status analysis. And I should actually mention here also that we were a team that worked on all this. Part of it was Martin, who you've already seen, but also Salim Fora, Felipe Silva, Professor Yan-Jung In-Wong from Thailand, Jean, who you've already seen, and Janice Chandro. And the country status analysis looked at a set of issues, including HIA policy, legal and regulatory frameworks, institutions and institutional arrangements, education and training capacities, the availability of tools such as guidelines, HIA practice, and the regional links such as the networks and bilateral arrangements in place. So I'm going to use the outcome of this analysis, and that's a snapshot really of what it was like in early 2018, although I must add that things doesn't seem to have changed very much. In the next slide, you will see some of the outcomes of that analysis. First of all, focusing on the policy status for HIA in these countries. The question there was, is there a specific HIA policy framework, HIA legislation or regulation? And we see the first 3 countries here. In Cambodia, no, there is no such thing as an HIA policy, although there's a draft that was developed and that is waiting for promulgation by the Minister of Health since 2009. But there is a draft law on environmental impact assessment, which has a very strong reference to HIA. Actually, it has one section that deals exclusively and in great detail to health impact assessment. But that draft law has been on hold since 2015, awaiting an overarching code for environment that still needs to be decided upon by the government. In Laos, PDR, yes, there is a decree by the Prime Minister, which dates back to 2006, declaration of use and implementation of national policy on HIA. And in addition, there's also a health component in the EIA policies with legislation and regulation. But there's no really specific reference to health. It doesn't mention things like community health and safety or occupational health. It just talks about health. In Myanmar, which is of course a country that has started to develop these things at a much later stage, we can say there is no HIA policy yet, but at least the EIA procedures from 2015 define the scope of EIA and include reference to occupational health and to community health and safety. On the next slide, we can see the other two remaining countries, Thailand and Vietnam. Thailand, which has quite a complex, and I'll come back to that later, a complex set of policies and laws that deal with HIA in different ways. The 2007 National Health Act refers to strategic HIA and to community-based HIA within the mandate of the Ministry of Public Health. And then there's a health component in the EIA policy and legislation within the mandate of the Ministry of Natural Resources and Environment. And finally, in Vietnam, again, no real comprehensive policy or legal framework specifically for HIA, and only a singular mention of community health in an EIA decree. When you look at the details of these situations, and then particularly the countries where there is a policy for HIA, you can see that there is really some interesting points that come out there. Thailand has a long history of HIA policy and practice, and HIA there has evolved along rather conventional ways, from project-oriented focus to strategic HIA of policies. Not really a sequential evolution, but rather an evolution of parallel strands under the mandate of different institutions. So the Ministry of Natural Resources and the Environment looks at health in EIA in a traditional way, looking at health dimensions of air and water pollution, construction-related dust and noise, sexually transmitted infections among construction workers and camp followers, and critical occupational health issues. The full integration of health in EIA there has to still be achieved. It doesn't really cover all the issues related to all environmental and social determinants of health. And you can see that the health component is present, but the checklist of projects requiring just an EIA without health counts 55 types of projects, while the checklist of projects requiring an environmental and health impact assessment counts only 11 types of projects. The strategic policy-oriented HIA in Thailand developed when this took stage in Europe, and the Thai health authorities were quick to follow that trend. The National Health Commission, which has been set up to oversee strategic HIA activities, is mandated to do so by the National Health Act. And it states that it is to prescribe rules and regulations of monitoring and evaluation in respect of the national health system and the impact on health resulting from public policies, both at the level of policy making and implementation. This commission is chaired by the Vice Prime Minister of Thailand, so it's a very high-level commission. And again, parallel to that, the Ministry of Public Health and Department of Health have an HIA unit which responds to community initiatives to investigate health impacts of development. The rights of individuals or community groups to request for and participate in the assessment of such health impacts resulting from public policy, program, or activity is enshrined in the 2007 National Health Act and also has its roots in the Thai constitution. So it's quite a complex setup with many different institutions playing their role and maybe lacking the arrangements to come to a really coordinated approach on this. In the case of Laos, the formulation of prime ministerial decree proclaiming the obligations to carry out HIAs for development projects stems from work that we did when I was with WHO in relation to one of the big dams that was being developed at that time in Laos. The then Minister of Health, and that was really a very personal thing of him, took a special interest, not only because of the expected hydropower developments in his country. He was also very worried about health impacts of legal and illegal gold mining. So the decree that was issued by the Prime Minister enabled the Minister of Health to establish an HIA unit in the MOH, to allocate limited funding for its functioning, and to assign some staff to carry out essential functions. National guidelines were formulated and a number of HIAs were carried out. And of course, interestingly, once this had established itself, the environmental people found that they didn't actually have a policy basis for environmental impact assessment. And so as a spin-off in 2010, a separate decree formalized the position of EIA, which, was really an interesting example of where HIA has taken the lead in policy development. So as said, in the other three countries, there's no specific policy framework for HIA, but we're waiting for things to see unfold as a result of the efforts that we did with the Asian Development Bank in all these countries. Now to come to the part of practice, because one part is to see what is there in terms of policy, the other part is what is there in practice. And on the next slide, again, you can see for the first three countries that we looked at what is going on there. In Cambodia, you can see that in terms of EIAs, there were quite a number of them commissioned, 1,345 in the period 1998-2015. And these resulted in 216 actual EIA reports. There's no information on how many of these had actual health component. But it is also, it should also be noted in Cambodia that some of the development actually takes place at the provincial level. Approvals for provincial development projects under $2 million don't have to be run through the national government. And so it's not clear whether at that lower level any of this impact assessment activity is happening. In Laos, with its HIA decree and policy base, we can see that there has been a lot of action in terms of HIA. But first of all, in terms of environmental assessments, 288 were reviewed during the 7th five-year National Socioeconomic Development Plan. HIA reports with an accompanying public health management plan were much less in number, only 10 in total, but they were quite huge ones, 8 for hydropower projects, 1 for a big coal mining project, and 1 for a special economic zone. To have a decree actually turns out to be a promotional and enabling environment factor in promoting the implementation of health impact assessment. In Myanmar, and as you will see on the next slides, also in the other two countries, in Thailand and Vietnam, there is no information that I could obtain for the number of EIAs, let alone number of HIAs. The only thing we know about Vietnam is that there have been EIA reports submitted for ministerial approval. So about 150 a year, leading to about 1,500 over a 10-year period. But then again, there is also an important level of decentralization. So there's not a total oversight of what's happening at the level of the 58 provinces and 5 municipalities. The estimation is that altogether, over the 10 years, an amount of 6,000 impact assessments have been done there. But again, not much known, or not anything known about the health part, except for a very small number of projects that have received important external donor support, and then HIAs were carried out in order to comply with the donor requirements for loans or grants. And of course, most of those projects were dam projects, which are, of course, projects that require quite a lot of investment. So to come to the next slide, some conclusions with respect to what we've now seen from this. There's definitely a lack of various things. Of course, first of all, there is a lack of policies themselves, but then also in support of creating an overall framework, there are no institutional arrangements between the health sector and the environment sector on the issues of impact assessment. There are no clear criteria that help decide when health should be dealt with in the context of an EIA and when a distinct standalone HIA is needed. The commitment of the health sector to HIA and to intersectoral public health management plans remains not very high, and that's an issue that needs to be addressed in the health sector, including the fact that once money has been allocated to a public health management plan, this means that this money should also be used to promote intersectoral action for health, and not just about strengthening the infrastructure of the health sector. And public databases on the number of EIAs and HIAs commissioned and carried out, and also on the status of resulting public health management plans and their outcomes are really badly lacking. Then, of course, what you see is the tendency to fragment HIA into subcategories, which doesn't really help its overall credibility. As we see in Thailand, 3 strands of HIA without any real interaction. And of course, the fact that in some countries, donor compliance seems to be a more important motivation than a genuine interest to promote public health in the application of HIA to development projects. So that is the experience that we had in the region of the Greater Mekong, in the Greater Mekong sub-region. Just in the next slide to go back very rapidly also to the other side of the coin, which is the issue of looking at HIA from the perspective of strategic HIAs and the assessment of newly formulated policies. And that goes back to the various EU treaties, or previously EC treaties, to begin with the Maastricht Treaty, which of course did focus on 3 main pillars: the internal market, the foreign policy, and the intergovernmental collaborative framework on matters of justice and internal affairs, but which really introduced or strengthens the principle of subsidiarity as it applies in the EC. So that means that the Commission, or now the Union, can only act on behalf of all if set objectives cannot be achieved by individual member states. And health is one of the issues that has really been left to individual member states to deal with. Except for the subsequent Treaty of Amsterdam, which was a sort of update on the Treaty of Maastricht, which defined the need to ensure the protection of human health in the development and implementation of community policies. So to support this, the Council of Ministers resolved to establish procedures to monitor the impact of community policies and activities on public health and healthcare. And of course, that was a major event for the health impact assessment community, and was picked up very actively at the time when it became effective at the end of the last millennium, the beginning of this one. Later on in the Lisbon Treaty, this was sort of downplayed a little bit again, and the Lisbon Treaty looks at health again in the way the Maastricht Treaty also did, in the sense that it really puts health as something under the subsidiarity principle to be dealt with by countries, and doesn't seem to be coming out very strong in favor of what was decreed in the Amsterdam Treaty. Okay, looking at the time, I would like to maybe in my next slide go to some of the key messages that I would like to have as for you to take home on this issue. First of all, there is a clear need to develop national policies that provide a basis for optimizing the application of health impact assessment, both in terms of looking at assessment of proposed macroeconomic policies and sectoral policies, but also for the assessment of proposed projects and programs in all sectors. Governments should address these needs by formulating such policies and by providing the resources and tools to put them into practice. Of course, tools refer mainly to guidelines, and those are available in abundance, but as things go, usually national governments want to then develop each their own national guidelines to deal with issues such as health impact assessment. It's also important that these policies provide clear decision-making criteria, and that they are carried out for policies, programs, and projects in a way that is fit for purpose, that is at scale, and that is designed to lead to a viable multi-sectoral public health management plan. In countries where such policies already exist, the legislative authorities should work towards the creation of a formal legal framework for health impact assessment where appropriate, linked to but distinct from existing legislation for environmental impact assessment, and towards the creation of a regulatory framework for the proper implementation of the public health management plans. Such HIA laws should also recognize the essential functions of the Ministry of Health as the national authority in all matters of public health. HIA policy criteria should clearly define the roles and responsibilities of the health sector, and that should be focused on the essential functions, in particular, as you know, the terms of reference for HIAs, and also the appraisal of HIA reports and of proposed public health management plans. And they should, of course, promote the policies. They should promote the creation of effective institutional arrangements between the health authorities and other public sectors. And in particular, of course, with the environment sector, which is mandated to do EIA. Then on the next slide, member states of the World Health Organization. We haven't talked much about the World Health Organization here, and the interest of WHO in HIA has had its ups and downs in the past. But I think that it's time that, especially in the light of the recent developments this year with the pandemic, the organization should maybe again take on board these issues of primary prevention. And therefore, member states, because they drive the World Health Organization, should, through the organization's governing bodies, support efforts that lead to the re-engagement with the concept and principles of HIA and to the mobilization and allocation of the necessary resources. And of course, a lot has to be done in supporting member states then in the development of capacity in all aspects of HIA. International finance institutions and other external support agencies also have a role to play. They should update their environmental and social safeguard policies, very much in the similar way that ADB did it through their project in 2016-2018, and to guarantee that protection and promotion of human health, especially of vulnerable groups, is dealt with adequately in the context of the development activities they're supporting. And finally, national and local authorities should ensure that in the process of formulating HIA-based public health management plans, all affected communities are involved and their meaningful participation in the implementation of such plans is encouraged. And that's maybe a hurdle that is not often recognized, but when I was in Iran in 2018 to look at health impact assessment policies there, one of the major hurdles that they have come across is that, in fact, local, rural, poor communities are not really very keen on impact assessments because they feel it slows down the process of development and keeps them away from the necessary progress that they want to make and the improvements in their livelihoods. So a very economic perspective there from local communities. Okay, I want to thank you all very much for your attention. I look forward to any questions you may have, and I look forward to the panel discussion. And now I hand back to Martin Burley, who will moderate the panel session. Thank you very much.
All right, this is Tanya. It looks like we're having some sound troubles with Martin's camera. Martin, I'm going to invite you one more time here at the cam request, but I don't have any option of changing your audio because it says that you're not connected to audio, according to this, even though you spoke earlier. Martin says he's going to look graciously and I'm going to take over questions, it looks like. So that's fantastic. So Francesca, we're going to bring you on. We have three wonderful folks. I will also invite Martin to add any comments that he would like to say on chat. And maybe, Martin, if you want to log all the way out and come back in and see if our sound works at that juncture, that would be fantastic. So, ladies, since I don't have your bios directly in front of me, I want to do a mic check. Francesca, can we hear you?
I can hear you, so I hope you can hear me.
And I can hear you, and Jean, we can hear you. So we are all set. I'm going to pose the first question to you, ladies. What kind of consultants are actually doing HIA, and in what context? For example, are they mostly done as part of EIA, SIA, ESIA, or SEA by clever generalists with no health training?
Well, I might start, and then I let Jeannie complement or probably, improve my answer. The health section of IAIA has just done a global survey on HIA practice worldwide. We have been doing it because we are updating the best practice IAIA document. It was very interesting to see the results. We reached mainly health impact assessment practitioners, so a lot of people consider themselves health impact assessment practitioners, although they still do it as part of other form of impact assessment. What was also interesting was the fact that there were 3 key regions, a little bit the Mekong region, which after Robert's presentation is not surprising, and then the North America, US and Canada, Europe, and of course Australia. So it seems that the countries that started to put some policy and framework for health impact assessment in advance are also the one that have produced more practitioners. You can find the publication online and on the health section website if you want to know more information. I don't know, Jean, what is your experience in Europe?
I think you have answered that question very well, Francesca. I have an intention to react to the keynote speech of Robert. If you could bring back Robert's video so I could see him. And if I could do that, please. I'm just trying to react with some of his statements saying that there remains to be tensions between the environment and health sectors or ministries about who has the mandate on HIA. I mean, in our region, in Southeast Asia, for example, or in the Western Pacific, I think this is not the case. We cannot generalize that. I give you examples in Malaysia, Lao PDR, Myanmar, Thailand, Philippines, Mongolia, and Vietnam, where I have personal experience working with them, and they have worked collaboratively, being able to have mechanisms to collaborate on how to deal with HIA, whether it's HIA in EIA or HIA as a separate standalone. I mean, for example, you know very well in Thailand, they have an HIA unit with 30 staff. 30 staff, the biggest in the world on HIA, I think. And they work very closely with environment ministries. The same with the Philippines and also the same with Laos, PDR, and Malaysia. So I think there is that kind of recognition or realization that these two ministries should be working together for the benefit of their people. So that's number one. The second, of course, is I agree with you that during the operational phase, some of the public health management plans struggled to be implemented, either due to shortage of trained staff, that has always been the case, and it's still the case, or the lack of funding for the mitigating measures. This is where I think there is a need for assistance more and more from WHO, development partners to move this further, to ensure compliance of public health management plans. This has been wonderfully done in the experience of EIA, where in my experience, when I was a staff at ADB, we were implementing through the social and environmental safeguards compliance of environmental management plans that has components of occupational health and community health and safety. So I think there are a lot of good things to report in the region. And also, but of course, we have very limited time to do so. And I understand also, Robert, that he also has limited time in his keynote speech. There's also good news that there is a working group on occupational health and community health and safety among the various development partners and international financing institutions, such as ADB, World Bank, EBRD, IFC, and so forth. And they're using WHO guidelines, and they have been working with us now to be able to develop their own policies and enhance their environmental and social with the stronger health components. So there's a lot of good news to be able to share. Something is going on. Perhaps this is an opportunity because of the COVID-19 also, and that there's a lot of climate change and health opportunities where health is put in the national adaptation plans or health is put in the national determined contributions of the countries. So, and there are, of course, funds from the Green Climate Fund where these are funded. So, I think that's my reaction to Robert. Any question? Is Martin there already to give us the next question from the chat, or?
Yes, he is.
I'm back with you. I'm afraid I've lost the thread because I had technical problems. Have we had the question from Isabella Vezina?
No, sir. And we've only asked the first question of the planned thoughts as well.
Okay, so let's go to this question here. Do you have any suggestions of clear criteria to decide when health should be dealt with in the context of EIA and where a distinct HIA is needed? Would anyone like to pick up on that one?
Martin, are you going to respond to that also? You can respond to that also.
You want me to respond as well?
Yeah, I want to, but you can do so yourself.
You know, the criteria seem to vary from one country to another, one institution to another. And for example, in the EC, there's been a a trend to increase the prominence of health within the EIA process. But I don't really feel that that's translated into specific action yet, although others may disagree with me. What I observe is that you get charismatic personalities who promote health in the EIA setting, and that happens rather randomly. What do others think?
I want to be able to say something about the criteria, whether it will be a standalone HIA or an HIA within the EIA. I think that's the question, right? Also, so sometimes it is in the threshold or the magnitude of the project. What type of project is it? Is it like a critical project or a highly pollutive or disruptive project? Then definitely, for example, in the mining sector, definitely you need a standalone HIA there. But there are some projects, for example, urban development, depending on the magnitude or the scope and the areas, you can put HIA within the bigger EIA. I think it's depending on the sector and the project. In the screening process, which Martin very well knows, you can identify in the screening and the scoping process whether what type of HIA should be done. Thank you.
I think just to add, I think that the scoping is really essential, and I think it's challenging if we think about talk about standing alone. I mean, I normally do impact assessment of mega projects, and the reality is that we need to work together. If we look at this, especially from a pandemic perspective, the risk factors leading to emerging infectious disease are land use change. We cannot look at this work without doing, without working with biodiversity experts or livelihood experts that look at how hunting impact certain issues. So I think it's very much about identifying what is significant and how to work together. So the scoping has to be the area where we look at how things should be done. So I think we should also evolve from, the standing alone or the environmental impact assessment. Is very much how do we work together, both as practitioners doing impact assessment, as well as what Robert was mentioning, there is a role for the project proponent, there is a role for the national authorities, there is a role for community. So the impact assessment should be the process bringing all the actors together to then develop an accurate management plan. And if you look at me, as long as there is a person out there that could be impacted, health should be included, one way or the other.
Why not?
Robert, you wanted to say something, I think?
Yeah.
You need to unmute yourself, probably.
No, I don't hear you, Robert. Oops. I think the technical bug has now moved from me to you, Robert.
Okay. No, I think
you're back.
Unmuted now. Right. Yeah. Okay. No, I just wanted to add to what Francisca was saying, because that is really the crux, I think. It's of course depending on the local context, but the screening and scoping exercise should give the answer to this. And there's obviously certain projects that you would say always need to have a separate health impact assessment. But other than that, it's really about setting the boundaries. And when you look at EIAs that look specifically at boundaries for environmental impacts, if you stick to those boundaries, you may actually miss out some of the health impacts that happen to communities that are outside of the boundaries of the environmental impact assessment. So that is, I think, the key thing to look at, whether your boundaries are adequate to look at to deal with the health issues that may be involved in the project.
Exactly.
Thank you, Robert. Shall we move on?
Yeah, just a comment on this. I think it's important also, again, we focus on environment and look at environmental specialists, but social and human rights specialists are exactly asking about increasing the boundary, not focusing on the small footprint. And that, for me, it's very much about increasing alliances instead of, focusing on on other things. So totally context and, you know, put in challenge to ensure that more issues are properly.
And of course, we need to identify that area of influence for assessment. It's environment for health, which is more, it's wider, as Robert said. It's not within the boundary of the environmental assessment. Okay.
Shall I read out another question now then? Have we had the first question, a question from Lara Henderini? Have we had that question? I don't think so. Okay. Thank you for your presentation, Robert. Policy can surely influence practice, but policy coherence is important. How can one cope with the complexities of conflicting policies and therefore potentially conflicting practices? For example, on different regional scales and policy. Potentially conflicting practices on different regional scales and policies that cross national boundaries. Robert, who's going to respond to that? Who would like to say something?
Yeah, I don't know whether I can't see anymore because I'm now on a slides presentation screen. I don't see who is talking and who isn't. But anyway, I think that what the question is very valid, and it was also something that we discussed during our assignment with ADB. And it really is in a region like the Mekong region, it's very important to see how at different scales you can still get a harmonized policy approach to HIA. As there will be obviously different conflicts of interest between countries over certain developments, even not only for health, but also for environmental issues. So that these are, of course, first of all, very political decisions, but there are also issues that require the establishment of networks and bodies that can deal with this regional dialogue on impact assessment. And of course, there are some of these. There is now the newly established Asia Pacific HIA network, but there's also, for instance, the WHO Forum of Ministers of Health and Environment, who meet every 2 or 3 years. And who discuss a number of issues, but they have in their agenda, they have health impact assessment. So it's those bodies that can, through dialogue and through getting to consensus on issues, can solve the inconsistencies that Lara is talking about.
Okay, does anyone else want to respond? I'm not sure if we're still on the same time schedule.
I don't know if we have the time. Yeah, but certainly you remember there are transboundary pollution or issues whenever there is a project. For example, a thermal power plant in one country, and the emissions are going to the other country. So these are the questions sometimes that you have to face if you're doing the assessment. But I think, as Robert has said, there are national measures or mechanisms to have dialogues on how to resolve these. And it has been proven between Laos and Thailand, for example, with an MOU that was prepared, and they have their joint monitoring, joint assessment, and regular consultation. Thank you.
Okay. I'm sure we could say a great deal more about that, but I suspect we should the organizers will have to tell me when they want us to stop. Otherwise, I'm going to assume we can continue a bit over time.
Martin, this is Tanya. You all just go ahead and keep going. Let's do at least 15 minutes more of question and answer for sure.
Okay, great. Thank you, Tanya. Well, then that's very clear. Let's go on to a question here from Felipe Silva. Do you see private sector actors having an important role in promoting HIA policy and practice in key sectors? For example, by setting and following internal company policies on community health and safety and HIA. Perhaps where national governments fail to set up HIA policy frameworks, these examples can be leveraged to further advance the arguments on the value of HIA to companies. So this is private sectors influencing the national story.
Well, I will have a first go and then I let everybody provide their answer. But I think it is. The oil and gas sector has come up with the second guidance on health impact assessment. IFC has done one. ICMM, the Council of Mining and Metals, has done one. As Jeannie was mentioning, ADB and a lot of other financial institutions have safeguards on occupational health and community health. I think that this is much more than what a lot of national governments have done about this. Of course, companies have also their internal procedure and processes and guidance. However, I think that the challenge is that, it's not an equal field. As long as a company might decide to operate in a way, and then another company might decide to operate in another way, and having this patchwork type of system is not the solution. So I think that the companies absolutely play a role in raising the bar and raising the standards, but I think is not enough, especially for an issues like health. When we a few years ago we come up with the idea of doing strategic health impact assessment when a new sector arrives in a country, because if you have a new sector arriving, being oil or gas or mining, it's very difficult to attribute to a specific project. If we talk about pollution or anything else, it's not a project by project. Another approach is needed. So I think it's absolutely companies can set up a better standard, but the government has to step in to really provide an operational framework for everybody to follow, so that then this can become a best practice and not just once in a while type of practice.
May I say something? Perhaps if you all remember the Equator Principles, yeah? The Equator Principles, there are more than 70 signatories of international finance institutions that are private sectors led. So, during their lending process, they require environmental, social, including health, safeguards mechanisms in their lending process. So they are a very powerful group, that are giving loans to the private sector for them to have infrastructure projects, for example. So they could drive this HIA process, or to include health more and more. And I think we should just be conscious about if they are members of that Equator Principles or not. Over to you.
I'd like to jump in with a bit of an answer as well, because I've observed over many years that some of the big players in the oil and gas sector have been very proactive with environmental, social, and health impact assessment. And they don't do it for the same reasons as governments. They do it for what they call the business case. So it's entirely a financial argument that reputation is valuable and must be protected, that a social license to operate is essential to operation of the project. And this drives them in the right direction, and it's very curious. Anyone else want to say anything?
Just a comment on this, Martin. This summer, there was a virtual symposium of the Society of Petroleum Engineers that brings together, most of the oil and gas practitioners. And after many, many years of discussion, I think that there has been a kind of consensus that health within the oil and gas and the energy sector is not just occupational health, it's not just the health of the workers, it does encompass the health of the community. So I think what we are seeing is also a shift from a more kind of philanthropic of doing good type of things to understand that, projects in the long term cannot be sustainable unless they look at the health of the local communities. It's a slow and changing process. So of course, it's a financial issue, it's a business continuity issues, but it's also an operational and a long-term commitment that might have changed. for me, the challenge is that if we leave it to individual operators, some will do the right things and others will not do the right thing. So it's more about, how do we take as example the cases that are absolutely functioning well and make them become more the practice than the exception. But I have to admit the fact that, we don't have to fight now to get community health on the agenda instead of occupational health, because community health is part of the agenda for many different reasons. So, absolutely, but we still have a way to go.
Anyone else want to come in, or shall I read out another question? Let's go on to another question.
Another question, please.
Right, here we go. Here's one. What can the health sector do? Is health in all policies still promoted by the health sector? And if yes, what has been the result and what can we learn from them?
Francesca, do you want to go ahead? And
Francesca, do you want to address that?
And I'll say something.
I think health in all policy is absolutely a key priority. How much the health sector is still pushing for it, I'm struggling. We talked about policy coherence before, and I think that this is a big issue. We see often, or at least I see, for example, trade policy becoming more important than health and veterinary policy. So how do we make sure that health is really, really understood, not so much in the terms of medical issues, but very much in terms of determinants of health? And we go back to policy coherence, capacity of collaboration between governments and ministry. And I think that, for example, if there are good cases from the Mekong region that Jean was referring to before, I think this would be, important to push. Yes, in Europe, there are the ministerial forums. How powerful they are in ensuring that, determinants of health become an issue, I think is challenging. Again, I'm a pandemic preparedness and response expert. And if I can say something about COVID, is that COVID has not generated this disastrous situation, has made clear the systematic and unequal vulnerabilities of a system. COVID made it worse, but has not created a lot of issues. So I think it's very much important for the Ministry of Health to reconsider how really to do health in all policy based on the COVID experience.
Yeah, if I may add to that, thank you, Francesca. I think now many countries, as my observation, is that they are promoting health in all policies under the whole universal health coverage. It's also another opportunity for the ministries of health and the health sector to work beyond the health sector to produce the right health outcomes. It's no longer just the health sector working to be able to promote and keep people's health, but also producing better health outcomes through, for example, better design health infrastructure or better design infrastructure projects, urban development, energy, transport, water and sanitation, for example. So all of these, as you have said, they would define and provide environmental and social determinants of health that would make people healthy. So however, there is also the need for more awareness raising within the ministries of health, and other partners, how health co-benefits can be highlighted and can be put, for example, in the project design or concept nodes of projects. And this is now an ongoing development to provide those health co-benefits in the various sectors that MOH would be involved, and that during negotiations within the Ministry of Finance, for example, health should be sitting in the conference room, health should in the same table as the other projects. Thank you.
No, I just wanted to say on that issue that, of course, yes, health in all policies has been around.
I'll tell you if we can hear you.
Can you hear me?
Nope, we don't hear you.
No, I can hear you.
Yes, we can.
We can hear you.
You can't hear me, Martin, but the others can hear me.
You're okay now.
No, and there is this ambivalence in the health sector. Of course, health in all policies has been around for quite a long time now, and it's all going back to the Ottawa Declaration, all that in the 86.
Yes,
and and these are these concepts that keep hanging on in
No, I
the
can hear you.
health sector. Yeah, but the health sector itself tends to have a level of ambivalence about it. I mean, they all think, even since Alma Ata, they thought intersectoral collaboration was a really important pillar for public health. Now we have universal health coverage. The health in all policies has been there for a while. These tend to become sort of window dressing principles, but with very little commitment to actually follow up on them and do something about it. And that has to do, of course, with the fact that in many of these instances, what you really want is other sectors to take the health handle and do something about it. And at the same time, the health sector wants to keep the control over public health issues within its own sector. So I think that WHO as an organization should set a strong example for this. And you see that whenever WHO does pay attention to something, ministers of health do follow their lead. So if WHO in its own structure would pay more attention to these issues, in particular to health in all policies, then I guess eventually that would trickle down and would also have an impact at national level and in national policies for the health sector and beyond. But that is something where someone has to take the first step and really make a firm commitment to it and allocate resources to this type of activity.
Fantastic. Martin, this is Tanya. Let's do one more question and then go ahead, Martin, and you can end with your closing statements.
Thank you, Robert. I think I better check with the organizers here.
Yes, you're doing great. We have time for one more question, and then Martin, you can end with closing statements.
Here's a question. Does the direction of... Yeah, okay. Yes, I heard you, Tanya, and here I go with a question. Does the direction of national and global economic policy tend to increase or decrease health resilience in human and animal populations? And how could HIA help to identify the trend and change it?
It's not an ambitious question. It's just a very simple one. So I will
not
just
a good question. Shall we go on?
No, it's just we have it's a lot. But I think again, look at this from as a pandemic from a pandemic perspective, emerging infectious disease. I think that our current development as a society is not increasing our health resilience. I mean, again, land use change and biodiversity reduction and climate change are all strongly associated with negative health outcome and increasing emerging of zoonotic and then for human diseases. So I think we really need to rethink about how we are going to look at these issues. And again, I talk a lot about COVID in these days, but I think we should remember that the history of humanity is shaped by the encounter between human and infectious disease. We thought that maybe we have, we have found a technocratic solution, a technical solution to our infectious disease problem, but COVID has demonstrated this is not the case. So I think it's very much going back to understand how everything that is human related and the way we interact with nature is, is affecting and increasing the encounter with diseases. So if we think about health resilience, we need to think very much about how do we create a better system that doesn't make us sick. And we focus on infectious disease. The same might be true for non-communicable diseases or other type of issues. So I think it's very much looking at, we talk about determinants of health, is looking at also a commercial determinants of health as a way forward. Can impact assessment do something? Absolutely. Can it do everything? Well, I would like to know what Robert and Jean can contribute to this.
Robert, would you like to say something? It is a very difficult question for me, but I am, as Robert and Martin knows, I am an optimist by heart and a little bit of idealistic. But I have seen in my experiences in my past lives that many of these things are possible, can be done. And it's, for example, the question about biodiversity and the prevention of zoonosis is being addressed now and being discussed. And there are measures on the ground in respect in different projects, for example. There are compliance requirements, for example, when there are construction near a forest area, that there would be the workers are forbidden to go to the forest, to take out some food or some use of the animals. So exposure to wildlife or biodiversity is now part of safeguards and compliance, and it's really happening on the ground. Over to you.
Okay, if I also can put in my penny's worth, the issue that Jean just raised is very important. The doing things in the local context, because that simplifies the solutions that you can bring to specific problems. I think one thing that I haven't heard in this discussion yet is that the other concept that is now becoming more and more popular, and that's the One Health concept. Looking at health, both from the human health, veterinary public health, zoonotic diseases, animal health, and ecosystem health in a sort of continuum way is going to be a very important basis on which we can then develop new policies that are responding to the issue that was raised by the question. And not only then doing that in the context of the health sector or the, let's say, the One Health sector, but also linking these to issues of other areas where there is a range of issues to be dealt with. For instance, look at the water sector. I mean, water now has a very comprehensive approach in the SDGs, with SDG 6, not only about drinking water anymore, it's about water resources, it's about scarcity and integrated water resources management. And of course, there are these big headlines in the SDGs, but then look inside these headlines and see how the targets that are defined there, how they interact. So how do things in the One Health concept at that level interact with the targets in the One Water concept, and then in the local context try to find solutions, of which obviously when it is about development, impact assessment, whether it's environmental or health or social, will have a very key role to play as a critical procedure.
Okay.
Wonderful. Thank you. Thank you. Martin, do you have any closing statements that you would like to make before we wrap up?
Tanya, I imagine it's time we wrapped up.
Martin seems to have a time lag.
Okay. I would like to thank the panel for their contributions. Oh no. Okay, I want to thank the panel for their contributions today. And apologies for the technical issues that crept in somewhere at my end so that I lost the thread. Hopefully we've now found it again, all of us, and we're finishing together. And so very many thanks to all of you for your expertise. And we hope the attendees have found this very useful. And if they want to keep on putting questions in, I'm sure we'll find a way of finding answers for them. Thank you very much.
Wonderful. And this is Tanya. On behalf
Tanya,
of...
it's over to you to close the session.
Perfect. Thank you, sir. On behalf of the team here at IAI, thank you so much for your participation in this event. We have multiple different ways for you to continue the conversation. First of all, you can participate in the bulletin boards. We do have a coffee session that is happening in just a couple of hours. So please check what time that coffee session is for your time zone. And Charles Kelly will be leading the conversation today. And those coffee chats are truly just an opportunity to network. So don't feel like you have to walk in with a particular agenda. It is a space to gather. In echoing Martin's appreciation, I significantly want to offer thank you to each of our presenters and panelists today. In this time of COVID, we have all become used to the adventures that are technical challenges in the world of Zoom calls and IT situations, but I want to thank them for the way that they not only navigated the technical challenges that occurred, but provided such consistent brilliance in the way that they responded to answers. So the great news is that everyone has the opportunity to go back and reread or re-watch sections from the presentation or re-watch sections from the Q&A section if they want some additional clarity through the technical challenge. So all my best to each of you, and I wish you enjoyment as you watch the rest of the sessions for today. Take care, and we'll see you tomorrow.